Hello, my name is Sean Rougeau, and I'm a psychiatric mental health nurse practitioner, board certified, currently working for the County of Los Angeles as a nurse practitioner in a county contracted facility. I'm here to introduce my clinical scholarly project. This will be the comparison between motivational interviewing in adjunct to pharmacotherapy as compared to pharmacotherapy as usual or standing alone. The major stakeholders involved in this project are all the staff involved with processing within this clinic. The groups related to this process are the 1. Administrative staff, 2. The psychiatric technicians, 3. The therapists consisting of the marriage family therapist as well as the licensed clinical social workers, 4. The primary providers of medication who would consist of the nurse practitioners and the psychiatrists, and 5. The clinic managers who will oversee the project in general. The roles that each of these players will be involved with are the administrative staff. They will be processing the patients at intake, starting the treatment process in general. They will also be initiating the establishment of the patient goals and utilizing the statements involved in motivational interviewing. The next group will consist of the psychiatric technicians. They will be initiating the patient's treatment plan. They will also be incorporating some of the motivational interviewing techniques within their process as well. The next group consists of the therapists. These will be the marriage family therapists as well as the licensed clinical social workers. While they will be initiating motivational interviewing within their treatment process as well, they have a basic understanding more so than the other individuals involved in this process. It's part of their training with regard to their education prior to entering the clinic. The primary providers of pharmacotherapy will be the nurse practitioners as well as the psychiatrists. While they will be initiating motivational interviewing, they will also be educating the patients on side effects and other aspects of treatment. The clinic managers are the last group I will address. They will be overseeing the project just to make sure everything is done above board and with all legal aspects considered. The education of each group will be different in approach from varying standards. Education of our administrative staff will consist of teaching the basic principles of motivational interviewing, promoting the reasons for motivational interviewing as an intervention, and a reference sheet that will consist of motivational interviewing questions as well as statements for them to provide to the patients. The psychiatric technicians will also be taught the basic principles of motivational interviewing, the reasons for promoting this therapy, and will be provided with the reference sheets for basic examples of the questions and statements involved. The education of our therapists is a little bit different. Since they already have the basic understanding of motivational interviewing, they're actually going to be more involved with training the other groups as well as presenting their own topics. They will be provided with reference questions and statements just as the others are, but in our weekly meetings they'll also help to motivate and train our staff. The education of the nurse practitioners and the psychiatrists will also consist of the basic principles of motivational interviewing. Their reference questions and statements will also be offered to this group. They will also be provided training from the therapists as the others involved. The clinic manager's education will be a little different. They will be provided with the basic principles of motivational interviewing as well as the statements and questions, but they're more so going to be involved with overseeing the project, so they'll just be given updates on the process as it occurs. Motivational interviewing as a conceptual framework is said to be a person-centered, goal-oriented approach for facilitating change through exploring and resolving ambivalence. The theoretic foundation is based on these principles. Another aspect of motivational interviewing is it's a developmental model. It's stage-based and sequential, and it's geared toward direct practice, which is very effective in our clinic setting. The plan of delivery will be to introduce the concept at clinic staff meetings on a weekly basis. As I stated before, the therapist will be very involved in teaching each of the providers and administrative staff all of the principles of motivational interviewing and how to proceed. The next step will be to obtain consent from each patient as they are the subjects of this process. We are also going to establish a control and test group at this time by interaction between the therapist to determine which patients are more likely to have benefit from this process. The last step will be to introduce the principles of motivational interviewing at all of these levels of providers. The process will be a cohort of everyone involved, motivating and supporting each other throughout each month of this testing.